Hello everyone, I am Dr. Shankar De and today we will discuss a very important topic in obstetrics practical examination, that is maternal pelvis. So let's start the topic. So this is articulated maternal pelvis. Articulated maternal pelvis is formed by this bone. These two bones, hip bones or innominate bones. This bone sacrum and this is coccyx. So two hip bones or innominate bones, one sacrum, one coccyx. And what are the joints formed by this bone? Anteriorly, two hip bones meets, pubic part of two hip bones meets to form pubic symphysis. So this is anterior joint, pubic symphysis. What are the parts of hip bone? This is pubic part, this is iliac part, and this is ischial part. This is ischiopubic rami and this is iliopubic rami or superior rami. This is inferior rami. This is obturator foramen. This is acetabulum. This is greater sciatic notch. This part is greater sciatic notch. This part is lesser sciatic notch, and this is ischial spine. So these are the parts of hip bone or innominate bone. This is iliac crest, and this is highest point of iliac crest. This is sacrum formed by S1, S2, S3, S4, S5. This is coccyx. Sacrum and hip bone here forms joint, that is sacroiliac joints. Iliac part of hip bone and sacrum, sacroiliac joint. This is one sacroiliac joint, this is another, and this part is sacrococcygeal joint formed by sacrum and coccyx. So these are the bones and joint. How to hold this pelvis in anatomical position? In anatomical position, this part, this is anterior superior iliac spine and this is pubic symphysis. This lies in coronal plane. This is coronal plane. This is sagittal plane and this is coronal plane. So this part, ASIS, anterior superior iliac spine, and pubic symphysis lies like this in coronal plane. And another thing, this is pelvic inlet. In anatomical position, this inlet, this part, pelvic inlet makes an angle of 55 degree with horizontal plane. So this is anatomical position. You have to hold like this maternal pelvis during your examination. So now how to trace pelvic inlet? So this is pelvic inlet. Pelvic inlet is formed anteriorly by pubic symphysis, then pubic crest and pubic tubercle, then upper part of the superior rami and horizontal pubic rami, then this part iliopubic eminence, then this linea terminalis or iliopectineal line, then this sacroiliac joint, this ala of sacrum, then sacral promontory. So now I am repeating this again. From anterior to posterior, pubic symphysis, pubic tubercle and pubic crest, superior margin of the horizontal or superior pubic rami, iliopubic eminence, linea terminalis or iliopectineal line, ala of sacrum and sacral promontory. Again on the other side, same features, ala of sacrum, sacroiliac joint, linea terminalis, iliopubic eminence, superior rami, pubic crest and pubic tubercle, and pubic symphysis. So this is the border of pelvic inlet. Now what is false pelvis and what is true pelvis? The part of pelvis which lies above this inlet, pelvic inlet. This is pelvic inlet. So so above this plane, this part is false pelvis, and the part of the pelvis which lies below this plane, like this part is true pelvis. So what are the boundaries of false pelvis? Anteriorly, it is by anterior abdominal wall, as it lies above the pubic symphysis, anterior abdominal wall. Laterally, these two part, iliac part of two hip bone, and posteriorly above this part, pelvic inlet, lies lumbar vertebrae. So anterior abdominal wall, laterally to part of the hip bone, posteriorly lumbar vertebra. What is the function? the false pelvis support the gravity uterus during pregnancy. Otherwise, it has very least role obstetric importance. Then what is true pelvis? This part which lies in between the pelvic inlet and pelvic outlet. This is pelvic outlet and this is pelvic inlet. This is true pelvis. And what are the boundaries of a pelvic outlet? Anteriorly, inferior part of the pubic symphysis, then ischiopubic rami or inferior rami, then ischial tuberosity, and then this part coccyx in between ligament, that is sacrotuberous ligament. So this part from pubic symphysis, ischiopubic rami, then ischial tuberosity and coccyx. This part from this is from pelvic outlet. So in between pelvic inlet and pelvic outlet, here true pelvis is formed. So now what are the different parts of true pelvis? One is pelvic inlet, also called pelvic brim. Inferiorly pelvic outlet. In between, this is called true pelvis or pelvic cavity. Now what are the different planes of true pelvis? One is called pelvic inlet, another I have mentioned pelvic outlet or inferior straight. Another two plane is there in between inlet and outlet. One is plane of greatest dimension, pelvic dimension, another is plane of least pelvic dimension. I will describe a few minutes later what is greatest and what is least pelvic dimension. Now first we will discuss the diameters of the maternal pelvis. First, diameters of the pelvic inlet. First, anteroposterior diameter. Here there are three anteroposterior diameter of the pelvic inlet known as true conjugate or anatomical conjugate. Second is one is true conjugate anatomical, second is obstetric conjugate, and third is diagonal conjugate. So what is true conjugate? So true conjugate is between anteriorly this superior border of pubic symphysis, this anteriorly this superior inner margin of superior border of pubic symphysis to midpoint of sacral promontory. So this point from inner margin of pubic symphysis to sacral promontory, this is called anatomical true conjugate or anatomical conjugate. It is 11 centimeter. 11. Next is obstetric conjugate. It is the distance between midpoint of pubic symphysis, is posterior surface, midpoint to midpoint of sacral promontory. This is obstetric conjugate. Another is the diagonal conjugate. Diagonal conjugate is inferior part of the pubic symphysis to midpoint of sacral promontory. This is diagonal conjugate. First one is anatomical, here to here, that is 11 centimeter. Next, midpoint of pubic symphysis to here, this is obstetric conjugate, 10 centimeter. Then diagonal from inferior margin of pubic symphysis to midpoint of the sacral promontory, this is diagonal conjugate. Diagonal conjugate is 12.5 centimeter. This is clinically important because this can be measured clinically by part vaginal examination. During part vaginal examination like this, you can measure this point from sacral promontory to this point. Like see, this point to this point. Through PT examination, you can measure this point. This is called diagonal conjugate. It can be measured clinically and it helps to rule out cephalopelvic disproportion. It is felt when AP diameter is very small. Now, what are the transverse diameter of pelvic inlet? Transverse diameter lies between this part, midpoint, distance between farthest point of iliopectineal line. This is one part, this is farthest point of another part. In between two farthest point of iliopectineal line lies the transverse diameter. This is 13 centimeter in length. Then what is oblique diameter? Oblique diameter starts from sacroiliac joint of one side to puboiliac eminence, iliopubic eminence of another side. So this part from sacroiliac joint of one side to this part, this is called oblique diameter. This is 12 centimeter. So this is one oblique diameter, this is another from one joint to another iliopubic eminence, 12 centimeter. So 3 conjugate diameter anteroposteriorly, through conjugate, obstetric conjugate, diagonal, this is diagonal conjugate, this transverse diameter, this, then this oblique diameter. Now see, this transverse diameter transversely and this obstetric conjugate intersects. So this line, this anteroposterior line and this line intersects here. So this is one line, this is another line. This point of intersection, from this point of intersection to midpoint of sacral promontory, this is called posterior sagittal diameter. This is 5 centimeter. Intersection of transverse diameter and obstetric conjugate to midpoint of this is 5 centimeter. Then one is sacrocortiloid diameter. This is midpoint of sacral promontory to iliopubic eminence. This part. This is sacrocortiloid. It is 9.5 centimeter. Importance in flat pelvis, biparietal diameter occupies in sacrocortiloid diameter of inlet during delivery. Now coming to the diameters of this pelvic outlet. Pelvic outlet anteriorly, anteroposterior diameter, inferior part of pubic symphysis to coccyx. So this part is the AP diameter or anteroposterior diameter of the pelvic outlet, and ischial tuberosity, this point in between two ischial tuberosity, this is transverse diameter of outlet. Anteroposterior diameter is 10.5 centimeter and transverse diameter is 11.5 centimeter. But during second stage of delivery, due to relaxation of this pubic symphysis because of hormonal relaxing, this diameter enlarges and the AP diameter becomes 13 centimeter in length. So normally 10.5, during second stage it is 13 centimeter and this transverse is 11 centimeter. Now what is plane of greatest pelvic dimension? It passes anteriorly through the posterior surface of pubic symphysis and posteriorly over the S to S3 junction. This is S1, this is S2, this is, so S to S3 means this point. So anterior-posteriorly this 2 point, anteriorly this point and posteriorly S to S3 junction, and laterally midpoint of acetabulum. This is acetabular cavity, so midpoint of acetabulum. So line joining this point anteriorly, laterally midpoint of acetabulum and posteriorly S to S3. So this part is called plane of greatest pelvic dimension. Diameter, AP diameter is from this point to S to S3 junction. This is 12 centimeter and transverse diameter is also 12 centimeter from this diameter, midpoint of acetabulum to another midpoint. This is transverse diameter of plane of great pelvic dimension, 12 centimeter. Now least pelvic dimension plane anteriorly this part, anteriorly pubic symphysis, lower border, this part, lower border of pubic symphysis, laterally ischial spine, this part, not ischial tuberosity, mind it. This is ischial tuberosity, this is, but least pelvic dimension is formed by laterally ischial spine. So lower border of the pubic symphysis, this ischial spine laterally, this spine, and in posteriorly tip of the fifth sacral vertebrae here. So this is this point and this point. This is least pelvic dimension. And most important question is, what are the importance of least pelvic dimension? It has many obstetrical significance. But before going to the significance of least pelvic dimension, just I want to mention the AP diameter and transverse diameter. AP diameter of this least pelvic dimension from this point to fifth coccygeal vertebra, this is 11.5, and this diameter, transverse diameter, is between two ischial spine, that is 10.5 centimeter. Now I will discuss the importance of least pelvic dimension. So least pelvic dimension is the narrowest pelvic step. If you look at this pelvis, two pelvis, this part this part is the narrowest. This pelvis is the narrowest pelvic state. It forms the upper boundary of the obstetric outlet. Obstetric outlet lies in between least pelvic dimension and pelvic outlet. This is outlet. So this is from upper boundary of obstetric outlet. It is the region where levator ani muscle originates. So levator ani muscle originates from this like this and forms the supports of the uterus. So levator ani muscle originates from the least pelvic dimension, and levator muscle act as a pelvic support. So in this plane also internal rotation of the head takes place. So after descent of the baby, after descent of the baby, after engagement in this plane, this part of the head vertex when touches this plane of this pelvic dimension, there further flexion of the head and internal rotation. So flexion and internal rotation of the head take place in this plane when this part of the head touches this pelvic dimension. Next, this is the landmark for pudendal nerve anesthesia, because if you know from your anatomical knowledge, pudendal nerve passes first through the greater sciatic notch, then again passes out from greater sciatic, then again passes into the pelvis through lesser sciatic notch by passing just below the ischial spine. So after PV examination, post-vaginal examination, ischial spine is flared and pudendal nerve block is given. It acts as an anatomical landmark for pudendal block anesthesia. And another importance is external os. External os of the cervix lies in this least pelvic dimension plane, and also lower. It is the lowermost part, and when the lowermost part of the head, this part of the head comes to the level of ischial spine, it is considered as the head is engaged. Engagement of the head means when the maximum transverse diameter crosses this pelvic inlet, means this diameter crosses this pelvic inlet, this is called engagement. When engagement occurs, this lower part of the head, this lower part of the head touches plane of least pelvic dimension. Another last important, it helps in the assessment of station. You know very well from your obstetrical knowledge, level of ischial spine is station 0, and when the head descends further downwards in centimeter, it is considered as station +1, +2, +3, and if head lies above this plane, 1 centimeter above, -1, -2, -3. So this part, this ischial spine also acts as landmark for station, determining station of fetal head. 0, below 0, +1, +2, +3, above 0, +1, +3. So this is all about maternal pelvis. And another thing, last thing, that if you know it is very well, that is curve of Caras. How curve of Caras or anatomical axis is formed. Anatomical axis is formed by joining the midpoint of all the epidiameter. First diameter is diameter of the pelvic inlet. So first pelvic inlet diameter, this anatomical conjugate midpoint, then this diameter, greatest pelvic dimension, anterior posterior midpoint, then least pelvic diameter, this diameter midpoint, then outlet, this outlet epidiameter midpoint. So 4 plane epidiameter midpoint join to form a curve. This is called anatomical curve or curve of Caras. It's like this semilunar shape. This is like this. It goes like from this, like a curve. So this is curve of Caras. And another thing, anatomical curve or pelvic curve is obstetric axis or anatomical axis is slightly different. Anatomical axis is like curve of Caras like this, but pelvic obstetric axis usually passes like this. First it passes like this, first downwards and backwards, then forwards and downwards. First downwards and backwards, then downwards and forward. So it's form a angle. So obstetric axis is like this, two straight line, and anatomical axis is like a curve. Another thing, this is called waist space of Morris, which lies just below the pubic symphysis and this pubic inferior pubic rami. This when a circular disc, if a circular disc is placed just below this pubic arch, the space found in between this pubic symphysis and the circumference of the disc, this part from this part is called space of Morris. Normally it should not be more than 1 centimeter in diameter. So this is all about articulated maternal pelvis in the diameter. So read very well for your practical examination. All the best for your practical examination, and don't forget to subscribe my channel. Subscribe, comment, share. Thank you.